Hi everyone, welcome to the latest edition of Coffee Break, our new series of interviews with PR professionals across the country. My name's Steve Barrett, I'm the editorial director of PR Week, and I'm delighted to be joined by Marvin Stockwell, who's the Director of Media Relations at St Jude Children's Hospitals. Marvin, welcome to the show, and great to have you here to chat to us.
Glad to be here.
Tell us about St Jude. I think most people know of the great work that you do, but just tell us a little bit about the organization and how it's structured and how the lockdown experience has been for you. I think you've been working from home like a lot of other people, but explain why that is,
Sure. So we're located in Memphis, Tennessee. We were founded 58 years ago by entertainer Danny Thomas. Danny first founded our fundraising partnering organization, ALSAC. 5 years prior to the hospital opening in 1962. Makes sense. You got to raise the funds to open the hospital. And there have been two separate organizations ever since. So I work over on the hospital side for St Jude Children's Research Hospital as the Director of Media Relations. But I also have a counterpart over at ALSAC, which is responsible for the fundraising. So I, as a PR professional, help to elevate our science and research and treatment. And our colleagues over at ALSAC are great at elevating the fundraising message and keeping that necessary support coming in.
And St Jude is primarily concerned with kids with cancer and other conditions.
Cancer and other catastrophic diseases, that's right. Danny Thomas said no child should die in the dawn of life. And at the time, cancer was considered incurable. Childhood cancer was considered incurable. At the outset of when St. Jude opened, the cure rate for acute lymphoblastic leukemia, which is the most common form of childhood cancer, was 4%. It's now 94%. If you average together all pediatric cancers, we've helped move the cure rate from 20% to 80%. It's hard to imagine this, but at the time that St. Jude opened, our original medical director, Dr. Pinkel, was mocked for even trying to cure childhood cancer. So it was accused of it being cruel. The working thought at that time was that if a child had cancer, you should make them comfortable so they could die in peace. And that's all that was done. So obviously—
That's great. That's fantastic to hear
that. Today.
We want to get right further than that, but that's great to hear, isn't it? Let's bring you today and tell us about the lockdown experience for hospitals, but also for yourself as a media relations professional. How's that been?
Well, I think all organizations had to pump the brakes a bit and say, what does the world need to hear from us? And St. Jude was no different. The old PR maxim, what would a responsible person expect? What would a reasonable person expect a responsible organization to do in a situation like this? The normal thing you ask yourself in a crisis. Now, this isn't our organization's crisis, it's the world's crisis. But I think a version of that question still has to be asked. What would a reasonable person expect a responsible organization to do in a situation like this? And how can St. Jude be helpful? Well, as I think the framing question that our leadership took a step back and asked. And then from that, we had to realize all sorts of plans that we had, conferences, areas of emphasis, were all canceled or scuttled or reorganized. And St. Jude started doing things that were directly in response to the pandemic. The first thing was our psychologists and child life specialists produced a coloring book for children to work through their fears and anxieties about the pandemic with a trusted adult. So as a PR guy, I was able to get that in USA Today and Forbes. And then it's been kind of making the rounds on television ever since, as we've issued a tween resource and a teen resource. On the more serious research—
Marvin, going in on that, what was the experience of promoting that to the media and engaging with the media at this time in terms of the way you would normally do it? Tell us about the process.
Right. Well, I had to navigate our own leadership's wanting to make sure that we didn't step out with the wrong message. But when we had a discussion and thought, well, this coloring book, which was originally designed with our patients in mind, we thought with a little bit of extra work, we could make this applicable to children anywhere in the world. And it's been translated into 13, 15 languages. So from a mission perspective, obviously, a little bit of extra work to do that much more good for that many more people was a no-brainer. And then obviously, you get that in the hands of more children if you promote it. So I was able to promote that. It was well received, and it got great coverage. In turn, what that did is not only get us coverage, but it also built confidence that we were on the right path as an organization, starting to say relevant things to the public.
Now, normally, I guess you would have some footage from hospitals of kids using the coloring book and doing that, doing the activities. Right. Did you manage to do that in a situation where, the kids in your hospitals are at high risk, aren't they? So you have to be very careful about that. What were the issues you had to face with that?
Well, truth be told, we have just we have not done that part. We have been able to get coverage for the coloring book and other resources without that. Now, a couple of TV stations have put together their own B-roll of the materials being used in their own house, and that served well. We've also got some pictures of our illustrator working on the project as a cutaway photo.
Okay. And what about the hospitals generally, the PPE and getting access to the right equipment? We've heard obviously all the stories about hospitals treating the virus and the issues they've had and the horrific, things they've had to see and dealing heroically with this.
Yeah.
How does that impact the Children's Hospital, where presumably there's a low incidence of infection, but obviously you've got to be very, very careful with the children being so
sure. Yeah, well, job number one was safeguard our campus in Memphis, so that our immunocompromised patients would be protected from the virus, and so far we've been successful in that, thankfully. The strength of the international relationships that St. Jude has. We've been active in international work for about 25 plus years. That all served us well. We have worked collaboratively with hospitals all over the world, not only to share best practices, but oftentimes share connections that have led to PPE being delivered to St. Jude. So we've been very fortunate in that regard that we have had a good supply of everything that we've needed. One of the other things that we've stood up is a COVID-19 registry and observatory for children with pediatric cancer. So we're leading a conversation with doctors, clinicians, scientists all over the world about best practices. What that allows us to do is hear from countries where the virus peaked first about what worked and what didn't work. Not necessarily directly in treatment, but in just very everyday hospital operations kind of things. And that's allowed us to have a better response on our own campus, but it's also convened a conversation with oncologists and pediatricians all over the world that's been helpful to all sorts of countries.
I think that's important, isn't it? This is a global issue, and we need to respond as a globe, don't we? And cooperation like that is something we really could do with seeing a bit more of it at the top levels of governments around the world. Frankly, a lot more cooperation, and it's good to hear work like that. What other things have struck you in terms of a PR professional during this time and working with your team and the way you're doing your job? In a work from home environment. What are the big surprises or biggest changes you've seen, or even the biggest things you thought, wow, this is actually great. We may stick with this when we come through this.
Yeah, no, the work from home thing has actually been a revelation. The tools that are at our disposal to work differently have come in very, very handy. I do think that there will be some things that we keep going forward. Meetings that have become streamlined out of necessity. Adaptation of the modern Zoom, WebEx, Skype call thing it has great utility. In the past, you can record these calls, which from a communications unit perspective allows me to record an interview that I facilitate. And then there's lots of extra content that can be gleaned from that content. And if I ship the file over to my people in our publications office, they can sort through it and create a blog post, et cetera. So the new tools are very handy. One other thing that's been interesting to navigate as a PR professional has been, I mean, St. Jude Children's Research Hospital also has a very, very deep bench in virology, immunology, and just an infectious diseases researcher and treatment, which have a very deep bench. So how to say something that's relevant based on all of our infectious diseases expertise that doesn't overreach and conflate our expertise in influenza, for instance, with COVID-19. COVID-19 is a brand new disease. That has been an interesting thing to navigate, but where I think we've gotten is that our experts do know a lot about pandemics and what to know about pandemics. And they're able to stop short of that line and not be kind of like drawn into a speculative discussion. And from a messaging perspective, that has been critically important because you want to be relevant and helpful where your expertise can be, but you certainly don't want to guess at things. And so sorting those different media requests has been interesting.
Yeah, I mean, we definitely need a bit more rigor being applied to some of the statements being made, don't we, for sure?
That's true.
And yeah, you're right about tools. It's not just new tools. It's this. We're recording this on Google Meet, where we've had that for years, but we've never really thought of using it as a part of our content production. And here we are, just doing scrappy interviews off the cuff like this, and it's working really well. I think. Hope so. Anyway, the users will let us know if it's not. Tell us about your dealing with your St. Jude colleagues around the country. You know, how about that, and what have they been seeing? You're in Tennessee, but there are others in New York, you know, which obviously got a much higher incidence at the moment. Talk me through.
Sure. So from a treatment perspective, there is only one St. Jude Children's Research Hospital in Memphis. However, we do have some affiliated hospitals elsewhere in the country. And we do have our fundraising colleagues at ALSAC do have regional offices all over the country. And so that has provided a lens into that. Case in point, we had a Colorado Springs TV station reach out because they knew their Colorado Springs ALSAC rep. And they said, gosh, we're reading this news about this COVID-19 registry that St. Jude is standing up and culling down the data. We're doing a dream home, which is a fundraising effort, selling tickets. They were in a dream home campaign, but they saw the work that St. Jude Children's Research Hospital was doing as relevant, and they wanted to do an interview. So the ALSAC colleague was able to hand off to me, and I was able to get one of our researchers to fulfill on the TV segment. So in that way, it does really connect us to media outlets all over the country who see something the hospital is doing that's relevant and they want to report on it. So that's where ALSAC's fundraising objectives and our desire to lift up our science and research kind of coincide.
All right, Marvin, we're coming toward the end of coffee break. So just to finish, talk us through how you think this is going to play out. When do you expect to be back in work in a physical environment? And when do you think things might open up a little bit? And what should we be aware of, especially in communications, in terms of second waves or third waves of this horrible health crisis?
Yeah, I think we're in this interesting moment right now where we don't know the degree to which COVID-19 might kind of dust back up, or whether there might be a second wave, so to speak. Hopefully not. From a St. Jude perspective, we are beginning to return our workforce to campus, but people much more directly tied to research that needs to resume and ramp back up, treatment stuff that needs to ramp back up. I'm kind of in the last category. Communications, our comms unit has shown that we can be incredibly productive working from home. So there's no reason to rush. If I had to venture a guess, I'd say we may not be back in our office until late summer, maybe early fall.
Yeah, that seems to be the way people are thinking. We did a survey last week, a couple of weeks ago. People were saying June, July, that maybe 50%. 20% were saying they don't really know, and others were saying So yeah, it is a little bit up in the air. But listen, I want to say thank you to you and all your colleagues for the amazing work you do.
Thank you.
Kids with very serious conditions. And thank you so much, Marvin, for joining us on Coffee Break.
Thank you so much, Steve. I really appreciate it.